let's jump right in. There's this fundamental assumption we all operate under, in business, government, healthcare, you name it. We assume that if you measure a complex system, you inherently improve its output. It feels intuitively right, doesn't it? Like if we can just see all the moving parts, we can manage the whole thing.
It's a highly logical premise. But when you actually sit down and observe these complex systems closely, a completely different, much colder reality starts to emerge.
It turns out, in many critical cases, more metrics actually produce worse outcomes. The very act of relentless observation actively degrades the system it's supposed to improve. Observation, as we're going to see, is not a neutral act. It exerts a force. And when that force is applied without understanding, it quite literally destroys the system.
When measurement becomes the absolute sole focus of an organization, the actual improvement drops to exactly zero. And here's the thing, it's not because of a lack of effort, it's not human incompetence, it's because of a hidden structural constraint that makes progress mathematically impossible. To see why we hit this 0 point, we need to look at the physical forces of regulation.
Part 1. The illusion of control. Picture a mechanical engine. It's running smoothly, generating continuous power. To keep that speed steady, we attach a basic speed controller, a governor. But we want perfect control. We want to know exactly what is happening inside that machine at every single microsecond. So, we start bolting on additional sensors. Gauges for temperature, for vibration, for pressure. We're adding immense diagnostic capability, sure, but we are also adding physical mass. With every new sensor bolted to that frame, we introduce new weight and heavy friction. We're forcing the engine to work harder simply to carry the physical burden of its own measurement tools.
Part 2. Escalation of noise.
That physical friction, it perfectly mirrors what happens in our human systems. As we add these continuous, real-time channels of reporting, the system begins to choke. The sheer rate of new information rapidly outpaces our cognitive limits. Increased transmission limits processing capacity. As this massive flood of input exceeds what we can mentally process, a bottleneck forms, and inevitably, the quality of our decision-making steadily degrades.
By bolting on more and more data points, the meaningful information, the actual signal that helps us understand what's really happening, starts to shrink dramatically as a percentage of the whole. Meanwhile, the background noise just exponentially inflates. The dashboards are totally full, but the actual insights are empty.
In information theory, there's a name for this mechanism. It's governed by this signal-to-noise ratio. It basically compares the level of a clear desired signal to the level of disruptive background noise. And when we optimize an organization for maximum data collection, this ratio plummets. A low signal-to-noise ratio means the essential truth of the system is corrupted. It gets completely buried under the heavy frictional noise generated by the measurement itself.
Before we continue, there actually is a calmer way to navigate this modern influx of data. Sift is a news app designed to give you a quieter way to stay informed. It highlights only the most important news, completely avoiding the endless headlines and sensational content. You can find it through the link in the description. Okay, let's look at what happens when a system is forced to rely on these corrupted signals.
Part 3. The target trap.
The consequences here escalate from just being a bit inefficient to active destruction once a system's survival depends on these degraded signals. Let's look at a hospital, for example. The intended overarching goal is obviously patient health. But patient health is a highly complex qualitative state. It's hard to track on a spreadsheet. So management naturally selects a proxy target that is easy to measure, reducing a patient's length of stay. Now the structural contradiction emerges almost immediately. To survive the immense pressure of that metric and secure their funding, hospitals naturally begin discharging patients prematurely. The measured target, reduced length of stay, is met perfectly, but emergency readmissions spike. Patient health declines. The system optimized for the measurement, and in doing so, it actively destroyed the underlying goal.
This behavior isn't some accident or fluke. It is a structural absolute. It was identified by the British economist Charles Goodhart, and it's known as Goodhart's law. When a measure becomes a target, it ceases to be a good measure. Because people have rational expectations, they will inevitably optimize their actions to game the metric within the reward system. Those doctors and administrators, they aren't failing, they are rationally adapting to the structure, sacrificing the actual goal just to satisfy the observation.
Part 4. Structural lock-in.
Here is where the trap closes. When leadership realizes a target has been corrupted, their instinct is almost never to measure less. No, the instinct is to measure more. They try to correct the distortion by layering on even more key performance indicators, or KPIs. But this introduces an inescapable paradox. If you add simple indicators, they just get gamed by the staff again. But if you design highly complex indicators to prevent that, they become too convoluted. Managers lose traction. The dashboard grows larger, the tracking increases, and yet actual control just slips further and further away.
Let's return to our physical engine. At this point, we've bolted on so many sensors, gauges, and complex diagnostic cables that the sheer physical mass of the measurement tools literally outweighs the engine itself. The friction increases exponentially. The engine begins to oscillate. It vibrates violently as all this heavy monitoring equipment completely warps its basic physics. The system is no longer producing forward power. It's entirely consumed by the effort of running its own sensors. Mechanical lock-in occurs. The engine seizes. Escape is no longer possible.
Part 5. Inevitable outcomes.
A systems thinking perspective demands that we view the world through the relationships of the whole. When we try to force a dynamic, living reality into narrow numerical targets, we create a structure that can only ever end in failure. We're left staring at this really stark contrast. As measurement increases to its maximum, genuine understanding decreases to its absolute minimum. We trap ourselves in a closed feedback loop where the attempted cure simply accelerates the disease.
When we witness these breakdowns, our first instinct is always to look for human error. We just assume the system failed because somebody somewhere didn't do their job. But the outcome was a mathematical certainty. It was engineered from the very moment the first excessive metric was elevated above the reality of the whole. The system was never failing. It was following its structure. So the next time you're asked to implement a new tracking dashboard, you really have to ask yourself, are you managing the system or are you just serving the sensors?